Good morning, ladies and gentlemen. Welcome to All India Radio Houston. I am Dr. NIK NIKAM. You're listening to us on 1050 KCHN AM. This is a new radio station we have, and we are going to be talking about Atrium Medical Center. And here with me, I have the CEO of Atrium Medical Center, Ahmed Ziad, and along with him, we have Dr. Satish Patel, who is one of the physicians, and we'll also be joined by a couple of other physicians later on. If you'd like to join in the conversation, the number to call here is 281-745-4161. Okay, let's begin. Mr. Ahmed, welcome to All India Radio Houston, and Dr. Satish Patel, welcome to All India Radio Houston. Let's start off by telling what is a little bit about Atrium Medical Center.
Well, thank you for coming, and we appreciate that you guys come to us for this interview.
Sure.
Atrium Medical Center been in the business for the last 6 years. It's a long-term acute facility. We're specialized in caring for geriatric and wound care, specialty in hyperbaric treatment, infection control disease, and we have also pulmonary and ICU for patients who has some problems with their lungs and respiratory problems. We are in the middle of Stafford, close to Sugar Land, southwest of Houston. We cater for a couple of major facilities. From acute hospital, from Methodist Sugar Land, Memorial Southwest, and West Houston Medical Center.
Wonderful. Ladies and gentlemen, you're listening to All India Radio Houston on 1050 AM KCHN. And if you'd like to join in the conversation, the number to call here is 281-745-4161. I am Dr. NIK NIKAM, your host. And let's talk about your vision and values of Atrium Medical Center.
Dr. Patel, if you want to elaborate on that.
Actually, the mission statement is the same as any other hospital. Serve all. But our major mission statement is deliver compassion, nurturing patient care to improve the quality of life within the community we serve. Deliver the patient-centered outcome, and our hospital is outcome-derived hospital, which is also to practice medicine on evidence-based medicine. Our goal is to achieve patients' optimal health, level of function, and quality of life through care management. That is the major mission.
We created something. I want to add to that our employee and all the Atrium team has created a small acronym. It's called CARE, which is reflect a couple of abbreviation for compassion, achieve, respect, and empower. And we try to pull all of that all together to give the best outcome for our patients.
That's wonderful. Ladies and gentlemen, we are talking about Atrium Medical Center, which is located in the southwest part of Houston, which provides geriatric care, and especially it emphasizes wound care and hyperbaric treatment for patients with chronic wound infections, and also ICU and special pulmonary services. Okay, let's talk about what is the bed capacity at your hospital.
Atrium Medical Center is licensed for a 68 bed. We have a 20 bed of ICU, and the rest are mid-surg. We are certified by Medicare, and the company that gives us our accreditation is called DMV, which is another board of accreditations through Medicare that approve us. We work with major insurance company such as Blue Cross Blue Shield, Aetna, United Healthcare, and also we take a private every case by case as well.
That's wonderful. Okay, Dr. Satish, maybe you can tell us as who conceived the concept of Atrium Medical Center, and how did this transpire into a existing facility?
Actually, as you look in the acute care hospitals, when you go to acute care, somebody gets admitted in the hospital, we found that patient require more care than what he was given in the acute care. And the lingering of the patient not getting better and being discharged, coming back again in the hospital, to and fro. So there was a concept developed, and this was from the Texas Department of Health, it's a federal thing, where they can provide long-term acute care on patients who meets the criteria for this type of hospital. So the concept of us, there was before there used to be one or two. There was in our area that was Southwest Memorial had it, and Triumph Hospital was a long-term acute care hospital. Been the physicians, been the patients, been in always talking about, hey doctor, they did not treat us well there, they did not treat us well there. We opened up our own, and this is where the concept of Atrium came in. The Atrium started in almost in 19, we are here since 2006. We started first in Bel Air Hospital, and from there we moved to the Atrium Medical Building itself.
Okay, maybe you can give out the contact information and location for those people who might be interested in using the facility.
Sure. Atrium, as I said, is in Stratford. The address here is 11929 West Airport Boulevard, Stafford, Texas 77477. Phone number is 281-207-8200, but also for referrals from physicians and the community, the last four digit is 8225, so 281-207-8225.
Ladies and gentlemen, we are talking about Atrium Medical Center, which specializes in geriatric care and wound care, and especially long-term care for those patients who are discharged from acute care hospitals. And they are located in the southwest part of Houston. If you'd like to join in the conversation, the number to call here is 281-745-4161. You are listening to All India Radio Houston on 1050 AM KCHN. This is our first program on this new radio station. If you're listening from any part of town, please call us at 281-745-4161. So we would like to know how far we are able to reach through our radio program. My special guests are Ahmed Ziad, who is the CEO of the Atrium Medical Center, and along with him we have Dr. Satish Patel, who is one of the leading physicians at this institution. So let's talk about some of the other services that you all provide, like x-rays, ancillary services.
Apart from the inpatient service, like any other acute care hospital does that, we provide outpatient services, which includes going step by step. We do provide lab services where we can do the basic labs of CBC, chemistry, thyroid, cardiac. We also do blood cultures, urine cultures and drug screens also up here. The second part, in terms of a radiological program which we have here, we deal with any type of X-rays, CT scans. We do it up. We also do spiral CTs for PE protocols. And at present moment, we are in the process of getting the radionuclide stress test, which can be done up here together with thyroid scans and those. The other part we have is a good active GI program where we have an outpatient GI program where we do upper epigastric upper GI series, which includes endoscopy of the upper GI system and a colonoscopy together with the pathology biopsy of this if required.
Okay, that's fascinating. Ladies and gentlemen, you're listening to All India Radio on 1050 AM KCHN, coming to you from Houston live, and this is also going to be on YouTube under my blog NIK NIKAM, that is NIK NIKAM, and we are talking about the Atrium Medical Center, and my special guests are Ahmed Ziad, who is its Chief Executive Officer, along with Dr. Satish Patel, who is one of the senior medical staff members at this hospital. Let's talk about how are patients referred to your place?
Well, the admission process at Atrium is pretty simple. The way that we doctors refer for us, if the patient in the community hospital around us, usually the doctor write an order that this patient will benefit from our services. Case manager contact us, and the process goes. But also we can add for that some physician from the community, if they believe that their patient needs the LTAC services, they know that their patient need 25 days of antibiotics or some services, we're able to do a direct admit. They can call us at 281-207-8225. We will guide them through this process. Unfortunately, walking in, usually the LTAC that does not have a full ER, we still can provide smoke services, but we don't, specialize in walking in services, but we can help the patients to direct them to other places.
Okay, can family physicians admit patients directly from home to your facility for like long-term treatment, like we were talking about antibiotics or some other type of wound care? Or any other special services?
I will ask Dr. Patel to answer that, because we do that quite some time.
Actually, as he puts it down, there is a criteria which has to be met by in order for them to come to long-term acute care. Most of the wound care would qualify for it because it would require a lot of hands-on antibiotics, nutritional status, managing the diabetes if it's diabetes. The direct admissions are patients who are really sick, who had been recently in the hospitals and have failed treatment at home, and now the family is thinking of going back to the hospital. They may want to try at a long-term acute care hospital like Atrium to see if further assistance can be given. If there is anybody who would like to come, the liaison of Atrium will go and evaluate and see whether they do meet the criteria set up by the licensing board up here, that they meet the criteria.
So they have to meet certain criteria.
Medical necessity needs.
Oh, okay. Ladies and gentlemen, you're listening to 1050 AM KCHN. I am Dr. NIK NIKAM, your host. If you'd like to join in the conversation, give us a call us at 281-745-4161. And you're listening to a talk on Atrium Medical Center. Ahmed, who is the Chief Executive Officer, along with Dr. Satish Patel. What kind of specialists do you have on staff here at this hospital?
The physician we have on the roster, around 150 physicians. They are accredited and they were practicing here. But they cater for all kind of specialty between internalists, cardiologists, pulmonary, and we have nephrologists, kidney doctors. We basically all services are provided at Atrium with all widespread. But we specialize a lot with infection control disease, wound cares. We do a lot of, we see a lot of renal failures. Nephrologists are very heavy involved with us because, as I said in the beginning, our patients, majority of them are geriatric, so they have a lot of complications. So, in a brief, we practice everything at Atrium.
Okay, Dr. Satish, let me ask you a little more